Hello everyone, I am Swarnim Adhikari, a fourth year medical student, and in this series of gynecology lecture, I am firstly going to talk about abnormal vaginal discharge. The abnormal vaginal discharge is a frequent complaint of women seen in gynecology OPD, and the discharge may be either an excess of normal or it may be pathological. It may be blood stained or it may be contaminated with urine or stool. So, firstly, talking about normal vaginal fluid. The normal vaginal fluid is watery, white, and non-odorous. The pH of normal vaginal fluid is 4.0, that is acidic, and in microscopy we can see that the vaginal fluid contains squamous epithelial cell with few bacteria including lactobacillus, also known as Doderlin bacilli, few gram-negative bacilli, and anaerobes. There are no WBC and no RBC in normal vaginal fluid. There are different causes of abnormal vaginal discharge that may be either due to non-infective causes, infective, or neoplastic, and foreign body. These are the four causes of abnormal vaginal discharge. And while differentiating non-infective from infective causes of abnormal vaginal discharge, the non-infective causes are non-purulent, non-offensive, and non-irritant, whereas infective causes are purulent, offensive, and irritant. The abnormal vaginal discharge has different causes in different stages of life cycle. In early neonatal period, if there is abnormal vaginal discharge, then we may point out to the probable diagnosis will be leukorrhea, and we will talk about this topic in the latter video in detail. And up to pre-menarcheal age, the probable diagnosis can be due to ill health, foreign body, and threadworm. These three can cause abnormal vaginal discharge in up to pre-menarcheal age. And in foreign body, in the vaginal discharge due to foreign body, the discharge is offensive, and due to threadworm, there is vulval itching. In puberty, also in puberty, when the probable diagnosis is leukorrhea, and if in reproductive age group, which is related to menstrual cycle, there can be the probable diagnosis is leukorrhea. In pill users, leukorrhea is one of the probable diagnosis, and another can be moniliasis, which is associated with pruritus. And in any time of the reproductive age, the vaginal discharge may be due to ill health, infective organism, neoplasm, and foreign body. And again, we can see that infective organism have associated feature of pruritus, they are itchy, whereas neoplasm and foreign body have offensive smell. And in the antibiotic therapy, in the women with antibiotic therapy, moniliasis is one of the diagnoses of the abnormal vaginal discharge, and it is associated with pruritus. Also in diabetes too, it is same thing. The moniliasis is one of the diagnosis of abnormal vaginal discharge, and there is associated feature of pruritus. In pregnant women, again, leukorrhea is one of the diagnoses of abnormal vaginal discharge, and another can be vaginitis due to moniliasis. In postmenopausal women, the vaginal discharge can be due to senile vaginitis, moniliasis, pyometra, and neoplasm. So, firstly, talking about non-infective causes of abnormal vaginal discharge, we have firstly the leukorrhea. Leukorrhea is actually defined as excessive normal vaginal discharge. To see as leukorrhea, there should be three criteria. Firstly, there should be persistent vulvar moistness and staining, staining of undergarment. While after drying, the undergarment should be brownish yellow. The leukorrhea, the vaginal discharge should be non-purulent and non-offensive, and it is non-irritant, and it never causes pruritus. So leukorrhea, it is a excessive normal vaginal discharge. It has characteristics like persistent vulvar moistness, non-purulent and non-offensive. It is non-irritant, and it never causes pruritus. It occurs during the condition where there is high level of estrogen. For example, in pregnancy there is a high level of endogenous estrogen that leads to marked overgrowth of endocervical epithelium, which may encroach into the ectocervix, and that may produce congenital ectopy, that is erosion, and that leads to the secretion and resulting in abnormal vaginal discharge. And during the menstrual cycle and around the period of ovulation and in premenstrual pelvic congestion, there can be leukorrhea. Around the ovulation, there is peak rise in estrogen, and that leads to increase in secretory activity of cervical gland, which causes vaginal discharge. In premenstrual pelvic congestion and increased mucus secretion from the hypertrophied endometrial gland. During pregnancy, there is hyperestrogenism with increased vascularity. This leads to increased vaginal transudates and cervical gland secretion. Also, during the sexual excitement, there can be vaginal discharge due to abundant secretion from Bartholin's gland. So this was about normal. This is normal, excessive normal vaginal discharge. This is due to excess of normal cause. And now talking about pathological cause of non-infective cause of vaginal discharge. There can be cervical cause or vaginal cause. Cervical cause include the non-infective cervical lesion like cervical ectopy, chronic cervicitis, mucus polyp, and ectropion. In this condition, there will be abnormal vaginal discharge. In vaginal causes, there is due to increased pelvic congestion in uterine prolapse, acquired retroverted uterus, chronic pelvic inflammation, pill use, vaginal adenosis, and ill health, there can be abnormal vaginal discharge, and that is due to non-infective cause. Talking about infective cause of abnormal vaginal discharge, the infective cause infective causes are Trichomonas vaginalis, monilial vaginitis, bacterial vaginosis, and cervicitis. In Trichomonas vaginalis, there is frothy yellow discharge. In monilial vaginitis, there is curdy white in flakes and it is pruritic. In bacterial vaginosis, the discharge is associated. This discharge is grey white, fishy odor, and it is non-pruritic. This is non-pruritic, contrast with monilial. In bacterial vaginosis, it is non-itching. There is no itchy. It is fishy odor, and it is grey white. It is curdy white. In cervicitis, there is mucoid discharge. And in neoplastic cause of abnormal vaginal discharge, there is fibroid. It can be neoplastic. It can be due to fibroid, polyp, and genital malignancy. And the nature is serosanguine mixed with blood. Often this is very offensive. And in foreign body, due to foreign body, there can be abnormal vaginal discharge. The foreign body like forgotten pessary, tampon, due to mechanical irritation. And the nature of foreign body AVD is offensive, copious, and purulent, often blood-stained discharge. Offensive, copious, purulent, and often blood-stained discharge. So for diagnosis of abnormal vaginal discharge, we have to do the usual procedure like taking this detailed history, physical examination, and investigation. The history should cover the symptoms, duration of discharge, any prior episode, associated dysuria, dyspareunia, pelvic pain, and use of contraception. Whereas physical examination have to cover general health assessment, abdominal examination for any mass or tenderness, infection of vulva for the discharge, if there is any ulcer, and we have to do speculum examination to detect any pathology in cervix and vagina. And we have to do bimanual pelvic examination to see if there is any foreign body, adnexal tenderness, or mass. And we have to finally do the investigation for the discharge, like microbiological study in the infective causes, pap smear to rule out any malignancy, routine urine examination, and tests like we have to do PCR, NAAT, and nucleic acid amplification test for any pathogens. And for treatment, there are certain guidelines like we have to improve the general health of the female. There we have to, like the cervical factor requires surgical treatment like electrocautery, cryosurgery, and tracheorrhaphy. Pelvic lesion producing vaginal leukorrhea require appropriate therapy for their pathology. The pills user have to stop pill temporarily, and if symptoms is very annoying, they have to stop the pill. Above all, the local hygiene has to be maintained, most importantly, to treat the vaginal discharge, and the treatment for a specific infection. So usually the treatment of vaginal discharge is just simple general improving general health, local promoting local hygiene and just treatment of underlying cause. So that is what all about abnormal vaginal discharge, and it is one of the common symptom that female present with in OPD. Thank you. That was all about this video, and next time we will come with another topic, another important topic of gynecology. Thank you. Have a very nice day.